Welcome to this week's podcast. Today we're going to be talking about eating and drinking for a person with dementia. People with dementia may experience problems with eating and drinking. There are many reasons this may happen. They might forget to eat and drink. They might experience difficulties preparing food or drinks. They may have difficulty recognising food items. They may have a change in appetite or taste. Eating a healthy and balanced diet is important for a person's physical and mental health. Not eating and drinking enough can increase the risk of dehydration, weight loss, a urinary tract infection and constipation. And these health problems can be particularly problematic for someone with dementia, as they can increase confusion and the risk of delirium and sometimes make the symptoms of dementia worse. And if you want to know more about delirium, there is a podcast saved on the website that you can access. Helping a person with dementia to maintain a healthy diet can be difficult for the people caring for them. Here's some tips on positive ways to help. It's important to consider the person's likes and dislikes regarding food. However, tastes do change throughout our lives. These changes may be more pronounced for someone with dementia. They may find certain colours, textures, or smells off-putting, or sometimes eat certain foods they previously wouldn't have. An increasingly sweet tooth is very common. This and other factors may make it more difficult for the person to stick to specific diets, such as those for people with diabetes or celiac disease, or those with religious or cultural needs. Understanding the person's previous relationship with food, as well as any cultural or religious reasons for avoiding particular food or drink, will be useful. Poor appetite and weight loss are quite common as dementia progresses. But there are also medical reasons why a person may have lost interest in food and drink, which a GP or perhaps your dentist could advise on. These include depression, which can lead to poor appetite, mouth pain and dental problems, which can lead to discomfort and a reluctance to eat or drink, constipation, which can make a person feel full or nauseous, infections or other physical illness. So if you suspect any of these, you need to get in touch with your GP or dentist. So how do we set the scene for meal times in order to encourage somebody to eat and drink? Well, a familiar social environment can help a person with dementia to feel more comfortable eating and drinking. So you could try turning off noisy TVs and radios, or playing some soothing, familiar music that your loved one enjoys. Being flexible about meal times, avoiding times when the person is tired or distressed. Giving the person lots of time to eat so there is no rushing. You could try eating with the person if they enjoy the social side of this. It might be encouraging to see you eating, but also you need to bear in mind that some people may be self-conscious and embarrassed to eat in company. So it all depends on your loved one and their personality. Make sure the room is well lit. This might help the person recognise the food they are eating more easily. Using plain coloured plates and cups is really useful so that they can see the food easily. Quite often we may encourage dark blue, because then things such as mashed potato can easily be seen in contrast against the darker colour. Specially adapted cutlery is available for people with dementia. So, how do we encourage a person with dementia to eat? Involve the person by asking them what they would like to eat. If they struggle to decide, you could give them two options of simple things you know they like and can manage. And if appropriate, you could involve them in the food preparation. You could try offering something easy to eat that you know the person likes, giving the person small regular portions rather than large meals. Being flexible. A person with a sweet tooth might like to eat their dessert first. You could add sweet condiments like ketchup or apple sauce to savoury foods to encourage them to eat more. Offering a small snack before a meal to see that if that helps the person realise they're hungry. Using different tastes, smells and colours to stimulate the appetite. Now, you need to remember that if someone with dementia is having difficulty swallowing, please seek advice of a speech and language therapist, also known as a SALT therapist, before considering a diet of pureed or soft food, as this can lack nutrients. You should be able to request a referral from your GP. Your GP can advise you on the food to offer while you wait for a referral, but it's a good idea to keep offering food you know the person likes and can manage. A person with dementia may not always be able to recognise when they're thirsty, or they might not be able to communicate their thirst. But nevertheless, it is recommended to aim for about 8 glasses of fluid per day. You could try having a drink beside the person at all times, adding a little flavoured squash if the person is not keen on water, offering a choice of hot and cold drinks, helping the person if they are struggling to pick up or hold a cup, offering the person different shapes and sizes of cup, finding out if they have a favourite mug they like to drink from. So how should we stock up and store food? Well, a person with dementia might need help keeping track of what food they have at home and storing food safely if they live on their own. You could try storing food in ways that are easy to access and eat, such as pouring cereals into clear pots or cutting cheese into cubes. Buying frozen ready meals, but be mindful that the person might need help reheating frozen food safely. You could put labels with clear cooking instructions on the top of the meal. You could put notes reminding the person that the meals are in the freezer on the freezer door. Check the person's cupboards and ensure you dispose of anything out of date. Some of the eating and drinking issues associated with dementia can lead to weight loss. Pureed food is less nutritious, and people with dementia are at risk of malnutrition. In this instance, you could try adding skim milk powder, such as Marvel, to whatever you are serving. Skim milk powder is available from most supermarkets. Mixing skim milk powder with milkshake powder, such as Nesquik. These are fortified with vitamins, and mixing this creates a high nutrient drink. It is important to note that there is different nutrition and health eating advice for people with dementia. For most people, the standard advice is to follow a low-fat, low-sugar diet. But older people and those with dementia especially need higher nutrients. People with frontotemporal dementia might be especially drawn to sweet things or starchy foods. If overeating or weight gain is an issue, you could try serving food in a portion rather than bringing out the packet, replacing sweet or high-calorie foods with healthier alternatives such as fruit or low-calorie jelly, encouraging the person to become more active by taking walks or swimming, or seated exercises for people with mobility issues, storing food away from the person's line of sight so they aren't tempted.